Good morning, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about um, neuropsychiatric um, Lyme and Bartonella, which I see a fair amount in my practice, and I have for many years. And my observation is that the infections are actually getting worse. And I believe one of the reasons that is so is that people were exposed to COVID, and COVID just triggered that brain inflammatory cycle, and it made the neuroautoimmune, the neuroencephalitis, and the neuroinflammation much worse. The reason that this is important is that in treatment for neuropsychiatric Lyme or neurobartonellosis or Babesia in the brain, I've also seen that. There is something called cerebral malaria, and so cerebral Babesia is probably very similar to cerebral malaria. So one of the first things you need to do is you need to stabilize the neuropsychiatric component of the infection. And that typically has to be done by a psychiatrist who is at least aware that there is infectious etiology to the aberrant behavior. What do I mean by aberrant behavior? A lot of people that have neuro-Lyme and neurobartonellosis will, especially children and adolescents, and even young 20s, some of the behaviors that they present are head banging, OCD-like symptoms, rage, spitting, hitting, kicking, and just emotionally and physically completely out of control to such an extent that oftentimes the parents feel like the child needs to be restrained in order to feel safe, because the child is not in their right mind. And so, of course, the infections are the reason that there's a problem, but you've got to get the neuroinflammation under control first, so that when they do go on antibiotics, which I would suggest that you very gradually get them on antibiotics. Start low and go slow. And that way you avoid any potential for a brain herx. A brain herx in these children can land them in a psychiatric ward, which is the last place they need to be, because nobody there understands that these tick-borne illnesses can cause this kind of neuropsychiatric symptomatology. So you want to try and find a neuropsychiatrist that is Lyme-literate, or at the very least Lyme aware, and get them on the correct medications. Sometimes it's gabapentin, memantine, sometimes it's Klonopin, sometimes it's Ambien, Lunesta, and get the brain sort of slightly more calmed down before you start going after the infections. And I think that by doing that, you set the patient up for success, which is what you want to do, So you start with the psychiatric medications. Once they become stable on that, then you can move to actually going after the infections. And the infections can be mold, COVID, and tick-borne. And so, but the experienced clinician will be able to tell which infection is first and foremost. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.